It was a humid Thursday evening when 34-year-old Angela Reeds walked into the emergency room of St. Joseph's Medical Center, clutching her chest, barely able to stand upright. She had been battling sharp abdominal pain for over a day but had held off visiting until it became unbearable. With no health insurance and a deep-rooted fear of hospital bills, Angela had hoped it would pass. But now, pale and trembling, she leaned against the reception desk and whispered for help. The nurse at the front barely looked up, asked her to take a seat and wait. "We'll call you when it's your turn." Angela nodded and limped toward the crowded waiting area, alone, unnoticed, and already halfway invisible. Security footage would later reveal the unbearable truth. Angela sat, then slumped, then collapsed in her chair, inch by inch over 6 excruciating hours. Her body curled inward, spasms visible on camera. She slid to the floor, unnoticed by the busy foot traffic of patients, staff, janitors. Nobody came. A few glances were exchanged between nurses, but nobody moved. The screens blinked. The intercom hummed. Time passed. Angela stopped moving just after hour 5. It wasn't until a patient pointed her out, a body lying still in the corner, that anyone checked. By then, she was gone. No code blue was called. No rush, no panic, just silence. Renee Reeds hadn't spoken to her sister that day. She was busy with work, but she knew Angela had been feeling sick. When the hospital called, they said only that Angela had passed away shortly after arrival. Renee, confused and panicked, asked for details. None were given. The autopsy showed internal bleeding from a ruptured ulcer, completely survivable if treated. That's when Renee requested hospital footage, driven by a feeling she couldn't shake. What she found broke her. Angela had died alone not because of her condition, but because no one saw her as worth saving. Renee tried the hospital first. She brought the footage to the administration. They called it an unfortunate oversight. They offered her a private settlement. She refused. She filed a formal complaint with the state medical board. She went to the media. The story made local news. Woman dies waiting for care, but the hospital pushed back. "We're investigating," they claimed, yet no one was fired. No policy was changed. In response, Renee turned to the patients who had also been failed, families who had lost loved ones under similar circumstances. A quiet storm began to brew. As Renee dug deeper, she discovered a hidden truth buried in paperwork and spreadsheets. The ER had a pattern. Uninsured patients, overwhelmingly Black and low-income, were consistently listed as low priority. Nurses used coded language, frequent flyer, non-urgent, stable. The triage system had been silently rigged to delay treatment for those who couldn't pay. It wasn't a glitch. It was a protocol. The ER director had even sent out a now-deleted memo, prioritized by reimbursement value. Angela was never going to be seen in time. She was collateral in a system that didn't see her humanity, just her lack of insurance. A former nurse named Carla reached out to Renee after seeing the news coverage. She said she'd quit the hospital after being reprimanded for insisting on care for an undocumented immigrant. "They told me, we treat who pays first," she whispered in a shaky voicemail. Carla handed over internal emails, timestamp screenshots, and patient logs that showed how certain names were flagged before they even walked in the door. Angela's name had a red tag, no coverage, limited priority. Renee took it all, to a civil rights attorney, to lawmakers, to anyone who would listen. It wasn't just a malpractice case anymore, it was a civil rights case. Renee's attorney argued the hospital violated Angela's constitutional rights to emergency care under EMTLA laws. A class action suit formed, with dozens of families joining. The hospital denied all wrongdoing, tried to settle again, quietly. But Renee refused. In court, the footage of Angela's final hours was played. Jurors wept. One stood up and left. A settlement was finally offered, along with a mandate for systemic reform. Renee didn't want money. She wanted names, accountability, and change. But even justice felt thin when measured against a sister lost forever. Renee now visits high schools and community centers, sharing Angela's story. She holds seminars on patient rights and ER triage awareness. Her voice shakes sometimes. She still cries when she sees waiting rooms. Don't wait, she tells people. Demand care. Document everything. Angela's death exposed a chilling reality. The system is trained to move around the most vulnerable. And unless you scream, unless you know your rights, they'll ignore you too. Angela became a symbol, a warning, a woman who sat too quietly for too long and paid the price. Hospitals are meant to heal, but sometimes they mirror the very inequalities they're supposed to treat. Angela didn't die because she was sick. She died because someone decided her life could wait. And how many others have done the same? This story isn't just about one woman. It's about a system that places profit over people. And until that changes, the waiting room remains the most dangerous place to be, especially if you're poor, uninsured, or unseen. Subscribe to the White Coat Crimes for more shocking true stories, medical crimes, medical mysteries, and the dark side of healthcare you were never meant to see.